This slide shows somewhat of the characteristic and background information about this client. In this slide, the cartwheel has been broken down into 5 phases. The key critical features are locked elbows, push-off, strong stability, and finish. This test is used for measuring a client's risk of injury. It is important to understand their measurements, especially when the client is performing the phase of a handstand and a follow-through, making sure having a good stability and balance. In the data, we can tell that the client had a difference of 7.3 centimeters on her right and left posterior lateral. This is due to the lack of range of motion, stability, and flexibility. This test is to measure one's individual movement pattern. It is important to understand their measurements, especially for this client, such as the active leg raise. We will be able to tell if the client is able to identify the active mobility of the flexed hip and core stability during the phase through the lift and handstand. The vertical jump test is to test the lower power body movements. Main muscle used are the quads, glutes, hamstrings, and calf muscle. During the cartwheel, it is important that the client needs to push off their legs during the force production phase. Muscles are included with extension of the knee, quadricep, gluteus maximus, hamstrings, and also the hip extensors. The prep stage focuses on the initial stance of a cartwheel, where the right foot points to the direction of travel and the left foot acts as a stability leg. The green arrow represents the client's hip pointing forward in a correct position. A wider leg stance will keep a stability, as well as both feet are pointing to the direction. This phase is called the lift phase. The right foot is then lifted, shifting the momentum forward while transitioning into a lunge. A force production is later on shown during phase 3. The balls of the feet is applied pressure to produce force for the left leg to extend the leg with plantar flexion. The momentum then shifts to the right leg for stability, where the center of gravity is located. This relates to Newton's second law, where the heavier the client is, the more force they will have to apply to achieve the same result in a cartwheel. This screenshot shows the first class lever because the fulcrum is in between the force and the resistance. You can tell that the right leg shows the fulcrum while the left leg shows the resistance, and torso and the arms are the force. If the fulcrum is too close to the arms, it will be more difficult to lift the upper body up and to transition to a cartwheel. In the lunge stage of a cartwheel, there must be a slight hip and knee flexion. With this slight flexion, this can decrease the rotational inertia enough for the cartwheel to be controlled and to be straight. This relates to Newton's third law, since we know that every action there is an equal and opposite reaction. So going back to the cartwheel, when the client put their hands on the floor ready to kick over into a cartwheel, there is a equal and opposite reaction during the force production. The green arrow shows that the back leg is slightly bent for compensation, while the purple angle shows the angle of the hip. Phase 4 is the handstand, where both of the arms are in contact with the ground, while both of the legs are in the air. Additionally, strong oblique and arm muscles are needed during this phase, since the tricep of the arm are in extension. In the screenshot, the purple angle indicates that there is a 91.9 degrees, meaning there's a larger split that allows more controlled and smooth lunge out. The orange line represents where the arms are in extension, meaning there's a solid base of support. When the client is in the middle of their cartwheel, their center of mass will be where the arms meet the midline. You can tell by this screenshot. Torque is the force on a rotational object. If the rotation on an object is quite forceful, then the torque will be larger. Seeing a cartwheel as a rotation, the torque will depend on how fast the client is going. The last stage is the follow-through. This is where the client is returning to the initial stage of a lunge position. Keep in mind that the client leg is slightly bent because the client will want to achieve balance and stability to prevent injuries. After the follow-through, the hips are pointing forward of the direction towards the initial starting point, while both of the arms are also close to the ear. The center of gravity is located within both of the legs. The movement testing really affects the strengths and weaknesses of the client's performance. The active straight leg raise could result in her weaknesses of the ability to extending her right leg as it is shown, where the Y balance test was able to show that the client has good stability in her initial and final stance. Some exercise technique that can improve the cartwheel would be yoga, wrist strength and flexibility exercises, and hip mobility training. These could all potentially improve a performance of a cartwheel.